Hello all, I am Dr. Vibhash Vaidya, and today in this video we're going to discuss about the osteology of sacrum. Friend, sacrum is also known as the vertebra magnum, and word sacrum is derived from Latin word sacred. This bone is large, flattened and triangular bone. You can appreciate here it is large, triangular and flattened from anterior to posterior, and this sacrum bone is formed by fusion of first, second, third, fourth and fifth sacral vertebrae. The sacrum forms the posterior superior part of bony pelvis, and the lateral part of the sacrum, you can appreciate here, these are the lateral part of the sacrum, and the each side of the lateral part of the sacrum which articulating with the corresponding hip bone and form the sacroiliac joint. The upper part of the sacrum is massive. You can appreciate here, this is the upper part of the sacrum which is a massive because it support the body weight and transmit it to the hip bone. And another side you can see here, this is a lower part of the sacrum, and this lower part is free form to weight and therefore it taper and rapidly. You can appreciate here anterior posteriorly the lower part is taper. Being a triangular bone, the sacrum has a base, and this base is known as the upper part, and the apex which is the lower part, and it has four surfaces. The pelvic surface, you can appreciate here, this is the pelvic surface, the dorsal surface and two lateral surface, one on the right side, another on the left side. Now first you can appreciate here, this is a pelvic surface. The pelvic surface is smooth and concave. You can appreciate here, it is smooth and concave anteriorly. While the dorsal surface on the another side, you can appreciate here, this is the dorsal surface of the sacrum, and this dorsal surface is irregular and convex. You can appreciate here, it is convex posteriorly as well as it is irregular. Then here on the either side it has a lateral surface, and this lateral surface is irregular and partially articular. You can appreciate here the lateral surface has a articular areas. The sacrum is divided by rows and foramina. You can appreciate here on the median portion, this is a median portion of the sacrum, and this median portion which transfers via the sacral canal. You can appreciate here, this is a sacral canal, and on other hand you can appreciate a pair of the lateral mass, and this pair of the lateral mass is formed by the fusion of the transverse process posteriorly. You can appreciate here, posteriorly it is formed by the fusion of the transverse process, while on the anteriorly it formed the fusion of the costal element. Now the anatomical position of the sacrum. So during the anatomical position, student, you have to remember these points. The pelvic surface, you can appreciate the pelvic surface of the sacrum which faces downward and forward. Then the upper surface of the body, here you can see this is the upper surface of the body, and this upper surface of the body of the first sacral vertebra slopes forward at an angle about 30 degree. You can appreciate here it forms a at an angle about 30 degree. Then the upper end of the sacral canal, here you can see this is the sacral canal and this is the upper end of the sacral canal, and this during the anatomical position, this upper end of the sacral canal is directed almost directly upwards and slightly backward. So these are the point which helps during the anatomical position. Now we'll discuss about the features of the sacrum. So first, student will discuss about the base of the sacrum. So we have already discussed, this is the upper broadest part, and this upper broadest part is called the base of the sacrum. The base is directed upward and the forward, and it formed by upper surface of the first sacral vertebra. You can see here, this is the upper part or upper surface of the first sacral vertebra, and presents feature of typical vertebra in modified form. That is, you can appreciate here, this is a body of the first sacral vertebra, and this body is in lumbar in type, and it articulates with the L5 vertebra and it forms the lumbosacral joint. You can see here the anterior superior part of the body of the first sacral vertebra projecting anterior, and it forms the sacral promontory. So guys, you can see here, this is the sacral promontory. Sacral promontory is a projecting of the anterior margin, and you can also appreciate here this surface slopes forward at an angle of 30 degree. Then the vertebral foramen. So you can see here, this is the vertebral foramen, and this vertebral foramen lies behind to the body. So here you can see this is a body, and just behind the body you can appreciate here this is a vertebral foramen, and this vertebral foramen lead into the sacral canal. So you can see here this is a sacral canal, and this vertebral foramen is triangular in shape. Then the pedicles. So here you can see these two are the pedicles. So student, always remember the pedicles are short and are directed backward and laterally. You can appreciate here these two are shorts and directed backward and laterally. Then here you can see this is the laminae, and this laminae are oblique, and most posteriorly you can see here this is a spinous process, and this spinous forms a first spinous tubercle. So here you can see this is a first spinous tubercle. Then you can appreciate here these two are the superior articular process, and this superior articular process which project upward, and you can appreciate here posteriorly this superior articular facet which bears a facet, and this facet which directed backward and medially. You can appreciate here the direction of the facet is backward and the medially. Then here this is a transverse process. So most posteriorly the lateral mass has a transverse process, and this transverse process are highly modified. Each transverse process is massive and fused with the corresponding costal element to form the upper part of the lateral mass of the sacrum. Here you can see anteriorly this transfer process fuses with the costal, anteriorly the costal elements, and it forms the, on the either side it forms the lateral mass of the sacrum. Student, you can appreciate here this is a lateral mass of the base, and this lateral mass of the base which forms a broad sloping surface spreading fan wise form to the side of the body. You can see here this is a body. On the either side of the body the lateral mass forms a fan shape spreading, and this fan shape spreading of the lateral mass is called the ala of the sacrum. So on the either side of the body this part is called the ala of the sacrum. The ala is subdivided into smooth medial part and rough lateral part. You can appreciate here this is a medial part, this is a medial part which is smooth, and this is a lateral part which is rough. Now the apex. So inferior free part is called the apex, and this apex of the sacrum is formed by the inferior surface of the body of the fifth sacral vertebra, and it bears an oval facet for the articulation of the coccyx bone. So here you can see on the inferior part the apex which bears a oval facet over here. You can appreciate here this is a oval facet, and this facet which articulate with the first coccyx bones. Then after the base and the apex, most anteriorly here you can see this concave surface is called the pelvic surface, and this pelvic surface which is directed downward and forwards, and the medial area here you can see this is the median area of the pelvic surface. The median area of the pelvic surface is marked by 4 transverse ridges. You can appreciate here first transverse ridge, second, third, and this is the fourth transverse ridge. and this transverse ridge which indicate the line of the fusion of the body of the 5 sacral vertebrae. This transverse ridge and over the 4 pair of the pelvic sacral foramen, and this pelvic sacral foramen communicate with the sacral canal through the intervertebral foramen. When we insert a wire through this pelvic sacral foramen, you can appreciate here this wire comes into this sacral vertebral canal. You can appreciate this is the pelvic sacral foramen, and in between this pelvic sacral foramen you can also appreciate here we have a bony bars, and this bony bars in between this foramen which represent the costal element. Then the lateral to the foramen, the costal element, here you can see this is a lateral part of the foramen, and this lateral to this foramen, this costal element which unite with each other and with the transverse process to form the lateral mass of the sacrum. So here this costal element unite with each other with this transfer process and whole it form the lateral mass of the sacrum. Now after the pelvic surface, on the other side you can appreciate here this is a dorsal surface. So as we have already discussed, the dorsal surface of the sacrum is rough and irregular and it is convex, and this costal surface which is directed backward and upwards. In the median part, here you can see this is a median area of the or median plane of dorsal surface. So this median plane of dorsal surface marked by the median sacral crust. So here you can see this is a medial sacral crust, and this medial sacral crust which marked in the medial area. This medial sacral crust which bears 3 to 4 spinous tubercle which represent the fusion of the spine of the upper 4 sacral vertebrae. So here it formed by the fusion of the 3 to 4 spinous tubercle. Then below to this medial sacral crust, the 4th tubercle, and there is an inverted U-shaped gap in posterior wall of the sacral canal. You can appreciate here a inverted U-shaped gap which is present in the posterior part of this vertebral canal, and this inverted U-shaped gap is called the sacral hitus. So here you can see this is a sacral hitus. So sacral hitus is inverted U-shaped gap which is present in the posterior part of the vertebral canal, and this sacral hitus is formed by the result from failure of the lamina of 5th sacral vertebra to meet posterior. In this sacrum you can appreciate here the lamina of the 4th and the 5th sacral vertebra is failure to fuse and form the this inverted U-shaped gap that is known as the sacral hitus. This is the median crust, and lateral to the median crust this posterior part or posterior surface is formed by the fused laminae. So this part is formed by the fused lamina of the first to 3 sacral vertebra. So lateral to this area of the fused lamina, the line which correspond to the superior articular process of 1st sacral vertebra to the inferior articular process of 5th sacral vertebra are free and form a sacral cornua. This free area is called the sacral cornua. The word sacral cornua comes from Latin word that means is horn like, and this sacral cornua which projecting downwards at the side of the sacral hitus. So here you can see this is a sacral hitus, and this is the inferior to the sacral hitus on the either side at the correspond to this superior articular process of the 1st sacral vertebra to the inferior articular process of the 5th sacral vertebra. This horn-like process is called the sacral cornua. You can appreciate here lateral to this articular process here you can appreciate on the dorsal surface it bears 4 pair of dorsal sacral foramen. So here you can appreciate it bears 4 pair of the dorsal sacral foramen, and this dorsal sacral foramen which communicate anteriorly to this pelvic sacral foramen. Then you can see here lateral to the dorsal sacral foramen, here you can appreciate another line, another crust like line, and this line is formed by the fusion of the transverse process. So on the either side you can appreciate here another lateral crust is present lateral to this dorsal sacral foramen, and it is formed by the fusion of the transverse process. Now the lateral surface. So here you can see this is a lateral surface of the sacrum. So this lateral surface is formed by fused transverse process and the costal element anteriorly. So anterior part is formed by the fusion of the costal element, and posterior part is formed by the fusion of the transverse process. And you can appreciate here the upper part of the lateral surface is wide and the lower part of the lateral surface is narrow. So here this is the lower narrow part and upper wider part. The upper wider part wears an L-shaped articular surface anteriorly. So student, you can appreciate here anteriorly it bears L-shaped articular surface, and the posteriorly it bears a rough deep patent area. L-shaped articular surface which is present on the anteriorly, and this articular surface which articular and it articulate with the hip bone at the iliosacral joint. Posterior part is pitted area. Here you can see this is a pitted area, and this area is formed by the transverse process. See here the lower part of the lateral surface is bending anteriorly, and this lower part of the lateral surface is also called the inferior lateral angle of the sacrum. So here you can see this is the inferior lateral angle. Now the sacral canal. So student, you can appreciate here this is sacral canal which present posterior to the body of the first sacrum, and this sacral canal is formed by the sacral vertebral foramen, and this sacral canal is triangular on a cross section. The upper end of the canal appear oblique, but actually it is directed upward in the anatomical position and inferior part. So this is the inferior part of the sacral canal, and this inferior part of the sacral canal opens at the sacral hitus. So we have already discussed about the sacral hitus, and the laterally it communicates through the vertebral foramina with the pelvic and the dorsal sacral foramen. So this is the dorsal sacral foramen, and these are the pelvic sacral foramen. The sacral canal, this sacral canal which contains the spinal meninges, the phylum terminal, and the subdural and subarachnoid space, and these structure end at the level of the second sacral vertebra. So this is just a second sacral vertebra. At this level the extension of the phylum terminal, subdural and subarachnoid space are end. So the lower sacral nerve and the final terminal pierces the dura and arachnoid at this S2 level, and this structure extend up to the S5 or phylum and this hitus of the sacrum. Going to discuss about the attachments of the sacrum. So the anterior and posterior edge of the body. So here you can see this is the anterior edge and this is the posterior edge of the body of the sacrum, and this anterior and the posterior edge of the body which gives attachment to the lowest fiber of the anterior and the posterior longitudinal ligament. The lamina, you can appreciate here, these two are the lamina of the sacral vertebra, and this lamina which provides the attachment to the lower pair of the ligamentum fleva. So here we have attachment of the lower part of the ligamentum fleva. Now the rough part of the ala, so we have already discussed the lateral part of the ala is rough and medial part of the ala is smooth. So anteriorly this rough area which provide origin of the iliacus muscle, while the posterior part, this part of this ala which provide attachment of the lumbosacral ligament. Then this margin of the ala here, this area which provide attachment of the upper part of the ventral sacroiliac ligament. Then on the pelvic surface, just lateral to the body, here you can see a E-shaped manner. Here we have a origin of the piriformis muscles. So this piriformis muscles takes origin from the pelvic surface lateral to the body and middle three piece of the sacrum. So here we have attachment of the piriformis muscle, and this area also extend into the interval between the pelvic sacral foramen. Here you can see it, and it forms the E-shaped attachment or origin. So this is the origin of the piriformis muscle. Then the dorsal surface, so here you can see this is a dorsal surface, and this dorsal surface gives origin to the erector spinae along a U-shaped line passing over the spinous and transverse tubercle. So here over the spinous tubercle as well as the transverse tubercle. So it form a U-shaped attachment over the dorsal surface. So here we have a origin of the erector spinae muscle, and the area in the concavity of this U-shape. So in this concavity of the U-shape origin of the erector spinous, here you can find a area, and this area which give origin to the multifidus muscle. So here we have a multifidus muscle. So on the either side U-shaped manner over the spinous tubercle as well as the transverse tubercle, here we have attachment of the erector spinae muscle, and area within the concavity, this area which provide attachment or origin of the multifidus muscles. So this is the attachment over the dorsal surface. Now the attachment over the lateral surface. So here you can see we have already discussed the upper part of the lateral surface is wider, and anteriorly it has a L-shaped articular area, and posteriorly it is rough area and pitted area. And this rough pitted area which provide attachment of the interosseous sacroiliac ligament. Then the lower lateral narrow part of the lateral surface below to this articular surface, this area which provide origin of the Gluteus maximus, and it also attached to the sacrotuberous and the sacrospinous ligament, and this area also provide origin of the coccygeus muscle in order to the anterior to posterior. Then the inferior angle, here this is the inferior angle of the lateral surface, and this inferior angle give attachment to the lateral sacrococcygeal ligament. So this is about the attachment over the pelvic surface, dorsal surface as well as the lateral surface. Now we'll discuss about the relation of the sacrum. So the smooth part of the ala, so here this is the smooth part of the ala, and this smooth part of the ala from medial to lateral side, it related to the sympathetic chain, the lumbosacral trunk, and iliolumbar artery and the obturator nerve. All these structure are overlapped by the psoas major muscle, and you can also remember these structure with the help of the one of the mnemonic, that is the oils. And on the pelvic surface, this surface which is related to the median sacral vessels in the median plane, the sympathetic trunk along the medial margin of the foramen, this foramen, and the peritoneum in front of the body of the upper 2/3 pieces interrupted obliquely by the attachment of the medial limb of the pelvic or sigmoid mesocolon, and the rectum in front of the body of the lower 2.5 piece of the bifurcation of the superior rectal artery lies between the rectum and the third sacral vertebra. Now we'll discuss about the structures transmit through the foramen. So first, on the pelvic sacral foramen. So here these are the pelvic sacral foramen. This foramen which transfers the ventral rami of upper foresacral nerve, the lateral sacral artery, then this dorsal sacral foramen, and this dorsal sacral foramen which transfers the dorsal rami of the upper foresacral nerve, and this sacral hitus emerges the fifth sacral nerve which grooves the lateral part of the fifth sacral vertebrae, a pair of coccygeal nerve, and the phylum terminal which passes to the coccyx. And the sex differences. The sacrum shows a number of important sex differences. First is the relation of this length and width of the sacrum can be expressed quantitatively by using the sacral index. The width of the first sacral vertebra is greater than the ala. You can appreciate here this is the width of the body which is greater than the ala in the male, and in the female we can appreciate the width of the ala is greater than the body. The dorsal concavity of articular surface is lesser marked in male. In the both the articular surface extend onto the upper three sacral vertebra, and the concavity on the ventral aspect of the sacrum is more uniform and is shallower in male. In female the concavity is irregular, especially between S1, 2 and between the S3 and S4. And the sacrovertebral angle between the fifth lumbar vertebra and the first sacral vertebra, this angle is called the sacrovertebral angle, and this sacrovertebral angle is more prominent in the female, and the downward directed of the pelvic surface is greater than in the male. The size of the pelvic cavity is more in the females. So these are some point which helps the sex differences of the sacrum. So this is about the osteology of sacrum. I hope all of you understood the topic. Thank you for watching.